So my name is Hector Del Castillo, and I'm Chief Product Officer at BoldPM, and I'd like to welcome all of you for tonight's discussion. This entire presentation is being recorded, and we will be making it available to everybody who signed up. Typically, we will send out a link as we post the entire video and audio on a page so that you can actually use this as a review if you're interested in coming back and reviewing the information. In tonight's discussion, myself and also Philip will be leading a panel discussion. And the focus of tonight's topic is, we've been hearing a lot of debates from all across US. Different states have their own plans on how to reopen the US economy during the COVID-19 crisis. We've been hearing a lot of information from completely opposite information often, and it's hard to really get a handle on what is the right thing to do. So tonight's discussion is going to be simply a roundtable discussion about what are the things that would make each one of you, the audience members, feel safer, so to speak, than safer than, let's say, you were at the beginning of the month or even a few weeks ago, that you would like to see before you actually feel comfortable getting back to some normal, and whatever that is, right? And I think that what we're going to be discussing is, what is that, what are those sectors, those type of workers that are least impacted to the ones that are the most impacted? And what are the things that can be done to at least allow those that can and that want to do this, and do this in a way that it's safe, and safe meaning minimizing additional human loss than we've had so far, and as well as minimizing impact to livelihoods, meaning people that need to work because they need to pay the bills. So that's really the topic for tonight's discussion. And Philip will actually give a follow-up demo of the live portal that we actually showed at our last meetup. And we'll be talking about some of the additional things that he's done, trying to look to see what the truth is by looking at data, as he's been collecting this data now for over 6 weeks now, I want to say. And it's basically for the entire world, but specifically, he's going to be using us, telling us about some interesting use cases that are looking at the dynamics of state by state for US, that we think we're actually going to be maybe looking at some differences. And he's going to lay out some use cases for us during part of the demo that we're doing. So let me make sure I can advance my slide here. Here we go. General housekeeping items, just real quick. The audience right now is on listen-only mode, so you can use your chat, and you can use the Q&A to submit questions. We are going to have a Q&A, and we want this to be more interactive, so we actually may open up so that you can actually have live questions. I want to make sure that at the point that we open up for Q&A, I sort of like basically shift to being a moderator, and then either Philip or I can actually attempt to answer any questions you might have, or maybe even open up the microphones to anybody who might have an answer for the questions that are being posed by the audience. If you encounter any audio issues, so this is why we're putting everybody else on listen-only mode, is because we're trying to avoid a lot of bandwidth being used, and right now we're trying to at least minimize that to just the panelists for the beginning, but we may open up the audio side, just the audio side, so that we're saving bandwidth if we're not necessarily seeing each other face-to-face, so to speak. You'll be able to only see Philip and myself as panelists. You can submit your questions using either the chat window or the Q&A portion of the Q&A window. Both should be available to you. We'll be monitoring those throughout today's conversation. And feel free to submit your questions at any time during tonight's discussion. And I think I said the last one, but just to remind everybody, we are recording the entire presentation, and we'll make the video available to you after tonight's live session. I want to actually give a shout out to all of our partners, make offices, because they typically will host us at their location when we are able to meet at a physical location. We typically would meet in their Tyson's location. And also, thanks to BoldPM, that's my company, Beyond, because we're actually using their Zoom webinar product, which is different than Zoom meetings. And this is the Zoom webinar that we're using, the platform. And the reason why we're doing it is because we can allow up to 100 participants using the webinar format, which is pretty interesting. And I don't think that we've ever had that many people show up, but we certainly have had the additional signups. And this is something that comes via Beyond. Earlier, somebody was asking me who was the other person that came on board, and that is Lori Wiggins. She actually is the Chief Executive Officer of Beyond. So I want to thank Lori specifically for allowing us access to Zoom webinar, because other than that, we would have to pay for it, for the actual usage of Zoom webinar. Also, Simtelligent, and that is Philip's company. Philip is CEO of Simtelligent, and he actually will be doing a demo for us. So you'll be hearing more about what Simtelligent does, and then showing up some of the capabilities that he has been able to do by doing integration and doing data management and creating solutions for different stakeholders very quickly. So all of these organizations are involved in allowing us to be here tonight. If you're on Twitter, use the following hashtags: BIDC, that's our hashtag, coronavirus, because everything that we're doing is related to the COVID-19 and coronavirus. Big data, analytics, meetup, and that's who we are. And basically what we're looking for, tonight's approach is going to be about figuring out how to use a data-driven approach to actually find the safest way possible to reopen the U.S. economy. That is tonight's topic. You can also use Philip's handle, P. Simulis, and mine at Hector Del Castillo, and we'll be more than glad to retweet or reshare anything that you want to share regarding tonight's discussion. We want to make this as interactive as possible, so if you're on Twitter and you're able to tweet, include these hashtags and these handles, and we'll be more than happy to share as well during tonight's discussion. The agenda for tonight is pretty simple. We're going through the welcome and announcements. We're going to be getting to discussion, doing the demo, and then doing Q&A. And hopefully this will be a moderator Q&A. So once we get into Q&A, we'll announce that. But you can feel free to submit any questions either using the Q&A window or the chat, and we'll be more than glad to entertain your question once we get into the Q&A portion of tonight's discussion. For those of you who are new, and I want to welcome all of you, if you're new, Business Intelligentsia DC is a meetup. We are a physical meetup that had turned virtual ever since, I want to say, our March meeting, when we had a sponsor that actually was virtually present for us doing a demo of their product. And you can find more information about us on our meetup page, but we meet every first Thursday of the year, and we already have announced the entire schedule ahead of time. And here is the schedule as we announced earlier in the year. That's tonight, and then all the other Thursdays, first Thursdays of 2020. And right now we're expecting to be virtual at least through June. It may be extended, and I'm maybe looking at extending it beyond June at this point. So I'll probably be announcing that in the next few days after tonight's meetup. And we're also going to be asking you if you feel safe if we actually would have a physical meetup in August. That's one of the poll questions. So another announcement. So this is actually the actual place where we talk about any upcoming conferences or summits. I do have some that I'm going to list. If you know of any, I would like for you to actually type in the information. So the name of the summit, whether it's virtual or not, and the dates, and then the link where you can find out more. And we're specifically interested mostly in local BI or analytics conferences or summits that you're aware of, or regional, Mid-Atlantic or maybe near us. And also anyone that may be interested in hiring developers or analysts or data scientists, or anybody who's actually looking for a new position in any of these type of roles. So use the chat to share any of these. And feel free to do so at any time, because right now I want to get into the ones that I announced last time. And since the GRC Summit of 2020, which was formerly announced as a physical meeting in DC, within 2 weeks is now 100% virtual, and that was announced by MetricStream. MetricStream, for those of you who are not familiar, is actually a GRC platform provider, and their summit, which they had originally planned to be in DC at the beginning of the year, they have since announced that it's now going to be 100% virtual, and it is happening on these dates. I've been getting their emails, and they actually have a few speakers, and you can actually sign up, and you can actually click through and get the information as to more information about this GRC Summit 2020. DevFest DC was formally announced also, I think as early as sometime February. I have not checked to see if they're now virtual. I suspect, given that this is early June, that they will be 100% virtual if it's going to happen at all. Many conferences that I've been looking at are sort of going 50-50. Some of them are just canceling or postponing till fall or later. Others are doing the same thing that MetricStream did, which is going 100% virtual as opposed to being a physical. And those are the two announcements. I'm going to actually now monitor the chat window, and I'm seeing someone saying that Samori sharing that there's a Hackathon 2020, which opens up, and he actually sent a link to chat to everybody. So if you can click through that, I'm actually going to click through this, and so hopefully I'll be able to show this information on my screen. And let me just make sure that now I'm sharing my browser. Where's my browser? Yeah, there we go. Oh, I see. So this might be behind sign in, I think, because it's actually asking me to sign in. So now that we're on my browser, I want to show you, here's our Meetup page. Here's the information that I had posted about how to join tonight's webinar information. This is our registration page, which is, and you can type in your name, or you can just type in this information if you have the Zoom client already installed on your favorite mobile device. This is the page that we had set up to announce this, and hopefully I'll be able to get through, but I do have another announcement on a hackathon, which I thought I had it here. Open up. Maybe I didn't open it up. Anyway, there's a NASA hackathon, and I actually, oh wait, so I know where it is. It's right here. I added to the comments a few minutes ago. So I'm going to go down. There's a NASA hackathon, and here is the link. It's on the comments already of our Meetup page. And NASA, this is going to be a virtual hackathon. And they're looking specifically for applications that allow different stakeholders to tackle the COVID-19 crisis. And it's a 2-day event, a 2-day virtual hackathon. And you can join from anywhere in the country. These are the dates when it's going to be held, and these are Saturday and Sunday if you look up your calendars. And there's an opportunity right now, if you look at the Learn More, there's an opportunity that you can register as a leader of a team, and then you can also then create your own virtual team. And what I would like to do is ask you, if you're interested in entering this challenge, and it's actually NASA along with the Japanese and European space agencies, all three of them are leading this hackathon, and it leads to a challenge later on in the year. So whoever participates in May for US will participate in a global one that is all three agencies and different teams in October, and all of these events are virtual. If you're interested in being part of a virtual local team, let me know, because I'm considering registering as a leader, but I want to make sure there's interest from the members of this meetup. in being a participant of this hackathon in May, which may lead to additional opportunities for October 2nd and 4th. I had discussed this with Phillip, and one of the things would be, hey, this may be a purpose for the portal that he has built, because his portal can be turning into a set of mobile apps, and that could be a hackathon about mobile apps that are just focused on solving problems because of the COVID-19 crisis. So if you're interested, let me know, and you can let me know via your chat window tonight if you know that you definitely are interested. If you want to think about it, I posted all of this as a comment. So just reach out to me either via email or Meetup and let me know that you're interested in being part of a virtual local team that can participate May 30th through the 31st for this challenge. And just wanted to let you know that right now, Phillip and myself are willing to be part of that team, being that we're local, and we'd like to get anyone in our meetup to actually also participate if you guys are willing to. I think it's kind of cool. I used to work for NASA, and so did Lori, by the way. Lori worked also in aerospace, Lori Wiggins from Beyond, and I hadn't had a chance to chat about this with her, but it's open to all members. And so if you're interested, just let me know, because there's more information on this page, and we can certainly at least maybe set up a separate Zoom meeting where we can actually discuss the possibility of just joining as a team and participate. So I'd like to at least know that you're interested so we can reach out and coordinate efforts. And so if you're interested, just let me know via chat if you're willing to do that, and we can also be able to share. The other part that I see that also I see on the Meetup for conferences, I'm actually monitoring the chat because I see that some of you, so there's a Hackathon 2020, and apparently the link that I was sent leads me to something that I must sign in. So Samori, let me know if I missed something, but it's asking me to sign in. I don't know that I would have time to do that right now, but oh, you sent me another link. Let me see if that works. It looks like it's working. Yes, here it is. So this link is what the second link that Samori just sent out, the long link, is what I clicked through, and this is the page. And this is a Kafka Summit 2020. For those of you who are not familiar with Kafka, it's actually a geolocation, data set or infrastructure for geolocation-based type of applications, which could be similar to the mapping that Phillip has done on his live portal, which you can see there's a map, and it allows you to zoom in and out, and allows you to go to specific locations and zoom in and see different things. The underlying thing that makes this work, and when it's actually looking at where you're at and if it's near you, is the Kafka infrastructure, and that can create it can be used as a infrastructure for any cloud-based geolocation mobile apps that are enabled by Kafka. And so that hackathon that is here is a summit, and event streaming everywhere is what they're doing. And you can actually sign up on this link. They already have some speakers announced, and they're looking for sponsors as well. And this information is shared by Samori, so you can go there. There's also an AWS Summit online, and let me see if this is a working link. So AWS Summit online, May 13th, so this is coming up pretty quickly. I believe this is next week already, 9 a.m. You can register here, and the link is also shared with everyone on the chat, so you can actually pick that up. And after this, I will be moving all these links to the comments, or if you submitted this, if you can actually add them to the comments portion of our Meetup page. It should be displayed right underneath my message. Just post the information here, and just provide the minimal information, what it is, the dates, and then the link. So thanks for all of you who have shared that information via chat. And so I want to shift. I haven't seen anything on maybe I want to make sure I didn't miss anything. Does anybody have any jobs to offer, or is anybody actively looking? Just let me know via chat. And what I would recommend also is you share the same information on the comments section of the Meetup page as well. And I don't see anything else outside of the summits. And either way, just submit information via chat, and we can always also share information during once we get into Q&A. So let me go back to my slides and go back to, here we go. We're also actively looking for sponsors because the rest of the meetups that we have, we're giving priority to any platform provider or anyone that wants to showcase applications like similar to the application that Phillip built for tracking COVID-19 cases around the world and in US specifically. If you have any interest in hosting or sponsoring a future meetup, click through this link, because you should be able to then get directly to our page that gives you information as to how to reach us in order to talk about the possibility of you hosting or sponsoring a future meetup on a date that we've announced in 2020. So without further ado, I'd like to get the conversation started. And tonight's topic, as I mentioned earlier at the opening, is looking at using a data-driven approach to reopen the US economy during the COVID-19 crisis safely. And safely meaning we want to minimize any additional human loss. We want to minimize any additional negative impact to livelihoods of workers who are unemployed or marginally employed, and they don't have enough in their finances to be able to pay the bills. And we want to make sure that at least we talk about all these different issues that come because of this COVID-19 crisis in US. So for that, the whole purpose of this discussion is to make it a roundtable and focus it around this question. What is a data-driven approach? There may be approaches, not a single one, but maybe multiple ones, that allows us to reopen the US economy safely. And how can we share this information with our leaders, whether it's political leaders, business leaders, and the workers who are impacted? What are the things that all these different stakeholders may need to actually feel safer in returning to whatever they do for a living? So that's the center question. And basically what we're going to be doing is just getting into the actual discussion. And to begin the discussion, I actually have a poll that I'm going to push through and I'm going to launch right now. And you should be able to see this as I'm launching it. So if you can answer this question, I'm going to give you a few seconds. I'll read the question. How have you been personally impacted by the COVID-19 pandemic? And here are the available answers. Pick one, the best one that applies to you. You've had no impact. You're mostly teleworking now, where before you didn't. You're unemployed now, all of a sudden, unexpected, or you're underemployed, or you're completely overwhelmed with work, like the majority of healthcare workers working at any hospital, at any major metro area in US, where there's significant number of confirmed cases. So I'll give you a few seconds to answer, and just want to kick off the conversation by asking you, Phillip, to share your answer to this poll question. Have you been impacted? I mean, tell us a little bit about what you do, who your clients are, and whether or not you've seen any impact on the workload for your company.
Sure. You know, I saw I can't vote. I was trying. I was smashing the button. I thought
there was a reason for that. I wanted you to share.
Yeah, that's actually a really interesting question, especially from kind of a business owner standpoint.
Yeah.
You know, and the biggest impact, unfortunately, we haven't been impacted on our current contracts, which is a good thing. The biggest area I think that we've been impacted so far is basically ability to get new business. And that's actually something that we're pivoting very rapidly on. And I think a lot of people need to rethink their messaging.
Mm-hmm.
You don't necessarily have to rethink your branding or what you're doing, but how do you get that message out in a meaningful way?
Mm-hmm.
And for us, we're really focusing a lot on automation, which is the same as we've always done, but getting that message out to manufacturers and GovCon about what we're actually doing, that spending a little bit of money really helps you save a lot of money.
Mm-hmm.
That can help people through a kind of a scary time. And honestly, a thought that I had about the other night when I saw the headline, I think I shared this with you earlier.
Mm-hmm.
We saw the headline that said that a lot of temporary unemployment situations are turning permanent. My pocketbook isn't that big, so I can't really go around, like, Daddy Warbucks handing out money to people.
Right.
But what we're going to start doing is, and we haven't figured out the number yet, but we're going to start donating a percentage of our profits to a local food bank. And
Okay.
they have a food bank, and they actually help pay utility bills for needy people. And
Oh, interesting.
so that's something we're going to start doing. At least we can do something. We can't help a lot of people, but a little bit helps. I think that's the biggest area though that we've been impacted, is getting new business. And I really feel for us as a business, it's kind of been a blessing in disguise. And a lot of people kind of look at me weird when I say that,
Mm-hmm.
but it's given us the downtime to really kind of refocus our messaging and kind of sharpen our sword on what we do and what we're good at.
Mm-hmm. Perfect. No, thank you for sharing. Lori, are you listening to us? If you can unmute yourself, can you share from your perspective, your answer to this question from Beyond's point of view?
Yes. Well, we've had for Beyond additional opportunities to propose work. Some people are moving ahead full speed. They are really moving forward aggressively, and they will be better positioned as we come out of this pandemic. However, we've had other deals that we were involved with be put on hold. And it wasn't because they didn't want to go forward, but it was because the buyer could not raise the funds to go forward with the acquisition. Even when both buyer and seller are in an industry that has not been affected by COVID-19, they serve the government contractors in the DC area and elsewhere, and government contracting has by and large not been affected by this pandemic. I second Phil's assertion about working further in your business and being able to take a step back and really look at what you're doing, how you're doing it, and making some changes. Thanks, President.
Thank you. Thank you for. So let me share. I'm going to end the polling because I think everybody has done. And let's see. I see that right now, the majority of you, 44%, saying mostly teleworking now. 33% of you are saying no impact whatsoever. And then a tie at 11% between currently being unemployed or underemployed now as a result. And few or no one is overwhelmed with work. So my guess is that we don't have any healthcare workers here in our attending tonight.
Hector, what I wanted to add, and as a result of your poll, and I didn't think about this earlier, but we are actually looking. We're not really looking to hire data people at the moment.
Yes.
But so this is for anybody that's on the phone or on the video conference here, or somebody that they may know.
Yes.
I am looking for help in marketing and or sales, and potential part or full time. So
okay.
that is something I want to throw out there, especially because you said people are unemployed on this call here. So
Mm-hmm.
that would be possibly helpful for them.
Okay, perfect. Thank you so much. And so here you see the results. I'm sharing them now. And you'll see exactly the results that I was talking about. So 44% of the audience is mostly teleworking now. 33% is the second biggest group, says no impact at all. And 11% is a tie for either being unemployed or underemployed as a result. And 0 that are currently overwhelmed with work. So that's the outcome. So thank you everyone that responded to this. And I thought it would be interesting to kind of see what the different perspectives are, how the impact has gone in different directions for depending on our work. I can share on my side. I've been doing a lot of international traveling for training, doing training in front of executives and managers. And at the beginning of the year, the different training providers that I work with, because I'm an expert training working through usually some sort of organization that provides my courses as part of a larger catalog, and they just book me for the rest of the year. And typically I had been working with them to give me more and more training days. Last year I did, I believe, on the order of about 80 training days. And I'm a contractor, so I get paid for training and nothing else, right? And this is live in-person training that requires me to travel internationally. Well, this year, there was a plan for me to have more than at least 100 training days in 2020. And up until now, I've only done 5 training days and nothing right now on the roadmap because everything was canceled for the rest of 2020. So this is the impact. Even if you are not a blue collar worker, let's say that you're not a plumber or a landscaper, with those people that you think normally would need to be working. I believe there's a lot of freelancers that are not necessarily in the blue collar category, like training, coaching, and that for the most part, if you look at from the perspective of the customers, especially when these are executives and managers, if you try to offer them a virtual, like using Zoom, like we're doing right now, as opposed to doing live training, what do you think is their perception about the quality of the content? Even though I'm one of the best instructors in this particular type of training that I do, which is product management, product marketing, which I've been doing for the last 20 years for different companies. What do you think is the perception of those executives and managers when they're comparing me as an instructor delivering live online compared to in person? And the short answer is that no one sees any value, right? And this is the reason why typically, even though I'm able to offer the same content live online, no one has up to now been willing to buy that product live online because they want me in person, right? That's a perception, their mindset. Well, now that there's no expert trainers traveling internationally anywhere in the world, my business model had to pivot, and I had to now replan my entire 2020 and figure out how to bring in a lot of those clients that were asking me, that were already telling me that they were interested in coming to my next set of live in-person training. And right now, at the very least, I've had about a 3-month gap between the time that this was announced and now my next live online training that I've been able to now get back in, reschedule in June. So the entire time between March, April, May, and I think right now, if I had to add up, I had lost at least 30 training days that were scheduled. I'm not going to have any revenue until June at best, right? Because that's the next time that I'm going to do a live training. So I'm not necessarily unemployed, but it definitely put me in the underemployed category just because I'm a contractor. And that I think is kind of interesting to see that in some cases, anyone that requires to be in person and doing international traveling, you're probably looking at not being able to do that for the rest of 2020. That is the impact in my case to, for people like myself. And I know a few of them that have decades of experience that, are in somewhere in the world where they're not necessarily in US, although there's a significant number in US, another number that comes from other places, but they're not able to do any international traveling to actually be doing the training that they get paid for as contractors. So that's kind of like the looking at the impact. I think that's part of the issue is how does it do we, what's going to make it safe? How is it that we're going to feel safe to go back to work if we are in that portion that is currently either unemployed or underemployed. And I think that those are the segments that we need to kind of explore who they are and how many of them are in US, because I don't believe it's all 33 million plus people that now have filed for unemployment. And I actually want to ask the question to the audience as to whether you believe I'm counted in that category of 33 million unemployed, because in my perspective, I haven't even filed for unemployment insurance. There's no need. You know, if I had to file, I'd be filing every other month as a contractor. So, but you know, that's basically what we're saying is, what is that number? Because I don't believe they're the current 33 million plus people that have already filed for unemployment, because there's, and we're in the middle of the gig economy, right? Think about all the Uber drivers. Think about all the Lyft drivers and the like. I believe there's more than 33 million out there not looking right now to file for unemployment, but currently they're going to have to reinvent and pivot their business models as freelancers, as contractors. So let me launch another poll, because I have a second poll that I want to see what you guys are answering. And I'm going to launch it, and then we can begin discussion. So the question is, which of these would make you feel more comfortable about returning to work? So what that means is that if you've had no impact, this may not be relevant to you because you're already maybe doing whatever you're doing. But if for those of you who are now for the first time teleworking, what would make you feel safer if you had to report to your normal work location, even if it's 1 or 2 days out of the week? You can pick multiple answers. Give me all the ones that you think are the most important to you in whatever you do, that will make you feel more comfortable about returning to work and feel safe. So here's the available answers. There's nothing, because I already feel safe returning to work now. Or I need more protective equipment because I don't have access to it, nor does my work location offer me protective equipment like goggles, masks, gloves. Any of those things are protective equipment. Access to hand sanitizer near me meaning home, work, and any location in between. Regular testing near me. Contact tracing applications to detect confirmed cases near me. Access to disinfectants near me, and disinfectants can be either for the workplace, for your home, or any other place in between that you normally would visit on any regular work day. Are nothing. The only way that will make you feel safe is when there is a vaccine. So I'll let you a few answers to this. And Phillip, can you share like what's the most important to you in your perspective? And think about not just yourself, but your entire household, your family. Think about those things. You know, what would happen if you or somebody else in your home brought the virus to your home?
Well, it's an interesting question because it's a very personal question.
Yes.
And my answer may not reflect, other people on here or other people. Well, two things. I guess my main priority as a breadwinner for the family is, number one, make sure I'm providing and keeping my kids safe. I mean, I guess it's a tie, right? I mean, we need both. It's a balance. And, and I guess, I will share openly that, what we do believe is that in February, we believe that my oldest kid did have it. Mm-hmm. He, had a fever that, he was sick for about 4 or 5 days, missed a few days of school. His fever did spike above 103 for a day. And, he recovered. And, I don't know. I may or may not have had it in January with very minor symptoms, but kind of wiped out for about 2 weeks. So my take on it personally, I wouldn't have a problem with, I guess, more of a going back to regular life in a sense that the model the Japanese followed. I don't know if I touched on this last time, but keeping your distance from people, being smart in the stores, not going back to crowded concerts, necessarily shopping malls or sporting events. If you could work from home. That's for me what works. And going with the data, especially following the model that we put together, or I guess the platform that we put together, we don't. And this is my biggest question on when it comes to science is, do we have data that shows anything in particular? I know we have models, and we have a variety of models to choose from depending on what side of the aisle you're on, or what your political or religious or whatever beliefs are. There's a model for you, right? And that's what makes it very challenging. With the risk of just kind of going on and on, I think for me, we're treating this as something serious that you don't want to catch. But life goes on. I don't want to, does that make sense?
Yes, it makes sense. Yes, it does. It
So
totally does.
That's my personal viewpoint on it. I know people who disagree with it, but that is what it is.
Yeah, no, thank you for sharing, because I think that's really the issue, right? Is that it seems like it's a kind of like this kind of relationship between your economic impact and human loss and less economic impact, and people are trying to figure out what is the right balance of that, right? Where is that balance between sort of like minimizing human loss, but also allowing those people that need to work, to pay the bills, to be able to do so, as long as they themselves know that they can do it in a safe manner. And so this is my question, is about what are the things that you must have access, and I think it ties back to that. I can show you my perspective, and I think that my perspective is, I'm fortunate that in my household, number one, I'm not the main the only source of income, right? So my wife is actually employed, and she was one of those lucky few ones that was able to mostly telework. Actually, she's doing 100% telework since Maryland was locked down, so to speak. And even as we talk now, because my wife does work at a healthcare facility that provides just general medical services to underinsured in the county where we live, right? So it's a nonprofit organization. And if you ever have worked or dealt with nonprofit organizations, they do a lot with very little, right? So I'm talking to her because she's on the administrative side, not on the healthcare providing side. She's doing all the admin work across multiple locations that they have clinics in Montgomery County. There's no location which she can report to physically where they don't do encounters, because even their headquarters, which is a repurposed home that now became their headquarters, they do have meeting encounters with patients, people that are walking in. And these are the people who are either no insurance because they can't afford insurance, or they're underinsured, and they're the blue collar workers that are out there doing work, that have to be doing work regardless of whether there's protective equipment or not. And many of them tend to be on the younger side, are the segments that are most vulnerable according to everything that we hear. And the likelihood of her being infected at any location that she can report to, in my mind, is highest, right? And I tell her, as long as you're here and you're able to do so, extend as much as possible, because she's still getting paid and with benefits, right? And those benefits are extended for the entire household. If I was the only breadwinner and I'm the freelancer, I would be out there trying to figure out how to repurpose my business model very quickly. And I'm already shifting, but trying to get back and recapture all those customers that I had lost. I think it's going to take some time, and I think it's a huge marketing effort. And marketing from a contractor point of view means it's non-billable work, and it's costs before there's revenue. And that is the challenge, in trying to figure out how to go back to, because my challenge is that I can do delivery of my stuff online, right? I don't have to be in front of the clients. The problem is, how do I sell when I'm not in front of clients selling my product, which is training and consulting and doing some work that they need to do? So capturing is the big issue. So it's very similar to the thing that you alluded to for your business, is that the current clients that you have been retaining, you're keeping, and they're giving you a good level of a good amount of work, but there's no new work because no one is willing to, even like try to talk to you, or because at some point they need to see you in person before they actually sign a contract. And that is just human nature. It's hard to overcome that, you're going to have to figure out how to acquire new customers when, they don't, normally they need agreements to have in place, and you can't meet face to face with them. So I think the challenge is not on my side, because I'm comfortable closing deals, and I've done so before. Electronic signatures, across oceans, that's what I'm used to. I find that on the other side, on the client side, it's not so easy for them to shift that mindset, especially if you're in a corporate culture that is just old school. And we can talk about some of those old school mentality companies, because they're here. You and I have talked about them. We can actually use that as some of our examples. So let me close the poll, and then let's share the results. So here's the results. Highest that most people feel is mostly like a must-have to feel safe, at 57%, at a whopping 57%. Most of us would feel safer if we had regular testing near us. Then a second, there's a tie at second at 43% each. More protective equipment near us and everyone else that we are nearby, not just us, but for everybody else that we're nearby, even as they're social distancing. That's the second closest. And there's another group that says, I don't feel safe until there's a vaccine. And those are tied at number 2.
I did want to ask one question on that particular option.
Yes.
Because we have a lot of vaccines these days. We have some from, like, say, measles, mumps, and right, was it rubella, MMR, polio vaccines. And these are tried and true for many years. We have some newer vaccines, which are controversial, right? And in fact, some say that they're actually causing autism and things like this. So my question is, I almost feel like we might have 2 groups. Obviously, there's not going to be a tried and true COVID-19 vaccine, right? Because whatever they come up with is going to be new. But I'm curious if within that group, if there's a difference versus, hey, we want the brand new vaccine, or preferably it would be tried and true. I don't know if that difference is within that group.
Yeah, that's an interesting question. If you guys can share via chat your perspective. Phillip is saying that, those of you that picked the option to have a vaccine, do you have any concerns about, adverse effects of whatever vaccine is created? Or are you comfortable given what you know about the history of vaccines? If you can share that via chat, it would be great. And we can actually share that as well. But that's an interesting question. I don't know the answer myself. From my perspective, I can tell you my personal perspective, and that is, if there's a vaccine that has been, time tested and proven over time, and measles and others are in that category, yeah, I would feel safe, because I think that relatively speaking, those have been time tested, right? Yeah. So having a brand new vaccine, you're right, there may be a higher risk, but I think that right now the need would be either, if I'm in that mindset that I need to have a vaccine, I'm maybe willing to take that gamble of taking the vaccine, knowing that is something that is the only thing that is going to make me feel safe to return to work, or at least be able to continue, in whatever that new normal is, that allows me to continue working and continue to do work, if I'm not able to do 100% teleworking like I would prefer. So that's I think my perspective. If you guys can share via chat, and then we can actually move on. We can actually do that.
I did
So
did you see Barry's response?
no, what is it?
He said a new vaccine that everyone else would take except for him.
Yeah, nice.
Laurie, do you have any perspective on the poll that we just did?
Well, I can appreciate those that would only feel comfortable if there was a vaccine. I can appreciate that. Obviously, that would be the best of all worlds.
Yes.
But I think that for some time to come, we will need to be social distancing. We will need to be wearing protective gear in public. If you really want to make sure that you're not going to be catching this virus. And also for those of us that have elderly parents, or we have older folks living in our household, we have to be very conscious of them and making sure that we don't pass anything to them, as well as anybody else that we're living with. The older people, especially those with underlying conditions, are most susceptible, as are others that already have chronic conditions, especially chronic respiratory conditions of any age. So there's a lot to think about here.
Agreed. Yes. Thank you for sharing, by the way. Hey, Philip, I stopped sharing so that you could actually share your screen. And if you can show us your portal, I think it would be a great time to get into that, and then show us the use cases and, sort of like where you think there will be, things that you have been able to find, anything that you've been able to find that you think is interesting. And what are your thoughts about, moving forward, tracking what's going on as state by state? Some states are starting to reopen as if, same old, going. I would say there's, yeah, go ahead and share it. We can talk about the data.
Is that for me, Hector?
Yes. Go
okay,
ahead.
Give me if you would, 1 second here. I'm looking for my charger, which
okay.
I just plugged it in. That's the disadvantage of working from home. My kids tend to steal my charger because they're doing online classes. So.
Okay. No problem. So what I can do is I can actually, there's a question that it's been posed, and that is, what is a rational expectation to start working in May for the next set of essential employees without putting a stress in our medical system? So I can tell you that I think the sort of like my perspective, and maybe Laurie, you can share as well. My perspective is that it may be a combination of all the things that we talked about in the poll. So for example, yes, I think the panacea would be to have a vaccine, and hopefully a vaccine that is time tested, but that's going to take time, right? This is the reason why we're saying it's about 18 months away, because clinical trials will start sooner, but clinical trials, if you ever have gone through the round, usually it's about 3 or 4 iterations until they find the best approach, the best vaccine that has the least amount of adverse effects across segments. And that's why you need to have not just one set, but multiple sets of clinical trials. And it really is, in essence, multiple A/B tests that you're doing, where you're using group A as a placebo, group B is one type of vaccine, and another group, another placebo with a different type of vaccine. And those are concurrently going on at any one time. There's a lot of complexity in tracking this because they're trying to do multiple vaccines, not one, multiple, and at the end of that time of the clinical trials, you end up picking the one or two that have the least amount of adverse effects, right? That's the nature of clinical trials in developing any vaccine. So the breakthrough right now, I think there's going to require a lot of reinvention to actually have a vaccine sooner rather than 18 months. And I don't think for most of us, it's going to be realistic to know that we're going to be 100% teleworking for the next 18 months. I think we're going to have to, rethink our perception as to what we are doing. And I think that part of the answer may be that we make accessible more personal protective equipment for everyone, regardless of who we are and what we do. That includes masks, gloves, goggles, any combination of those things, and make them available to anyone who wants to buy. And if you're in a higher risk type of work category, let's say a role in your work, that you actually are provided that personal equipment by your employer for your work location. And that includes, people who are actually doing the packaging and loading boxes that we're ordering through Amazon. Because one of the things that came out in the news is that 6 different major distribution centers for Amazon had a problem because they had confirmed cases, and those people were infecting other Amazon workers, and they had to partially shut down because those workers were not willing to continue working without Amazon proving to them that they were not only going to provide them protective equipment moving forward, but also disinfect all the workstations across 3 shifts more often than before. And that's just Amazon, right? And Amazon has been like getting a huge increase in orders, and now they can keep up with those orders because their workers that are fulfilling the orders don't want to report to work because of that issue. And if you think that that's not going to happen again, think again, because JBS, the largest meat packing vendor in the US that packs all sorts of meat products that are sold in multiple grocery stores, had the same issue at major meat packing locations, and people stopped wanting to report to work because they had confirmed cases and deaths of the employees at the workplace because those workstations don't have any physical distancing, and they would have to do a lot of retrofitting to put actual guards between one person that is next to you and the other, and whoever's up the line, when this is all people that is doing a lot of manual work. Because Phillip, can you share your perspective as to what we found as far as the adoption of technology in food manufacturing?
Well, it's definitely lagging.
Yeah, talk about what you found when we went to that food manufacturing summit last year.
Sure, there's a variety. Very few. In fact, I think Danone was the one impressive company that is really ahead of the curve when it comes to manufacturing and adopting technology.
Mm-hmm.
Part of it, which is possibly not 100% relevant for here, but how do you get new food products out quickly? How do you get new food labeling out quickly? They were kind of ahead of that curve. A lot of manufacturers are behind the curve, where they're not really sure how their metrics stack up, their quality metrics, when it comes to availability and performance and quality of their materials. A lot of it is either on paper or in people's heads where, it seems about like it's good enough. So they don't have any way to measure. And automated systems are 100% lagging because people don't always see an instant ROI. What is the ROI on this? And if it's not very clear to me, I'm not investing. Mm-hmm. And some of those people have come to mind in the last couple of months where I'm in the process of calling them back because I feel like they really need our help. They need to automate. When you have people babysitting a pressure gauge, for example, that person doesn't need to be there. If we can automate that system for them, they're removing 8 or 11 people, from the floor. I think that would be a huge win from a variety of places, right? Increasing quality, increasing production, and increasing safety.
Mm-hmm. Yeah, and I want to say the third case that just happened, I think this was announced earlier this week, is Tyson's, right? If you guys are familiar with Tyson's, they are the largest chicken producing manufacturer in U.S., and the same thing happened to Tyson's, to the point where they were basically telling employees, hey, we'll give you an additional $500 bonus if you're willing to return to work immediately, and no promise of any protective equipment for the workers, and no ability to do social distancing between workstations. Everybody's right next to each other, and they've lost capacity of actually packing chicken products. So that really has now impacted the supply chain where they source the chickens that they have to process. And just at the beginning of the week, there was a big announcement that the major chicken growers, and these are industrial farms that grow chickens, they're looking at now, because there's no Tyson's or any other facility that can pick up, the production of the chickens. They need to euthanize over 14 million chickens that can't be processed because Tyson's lost major capacity in producing, and now they're going to have to slaughter those chickens as opposed to finding a different way of getting them in the hands of people who want to at least consume some meat in the meantime. And if you're looking at aisles right now, no matter whether you're going to Costco or Walmart or whatever brand you're shopping, there's there's already a shortage of beef and pork in certain stores. There's going to be, in the next few weeks, a shortage also on chicken meat at any store. And it's starting with the big chains that sell the quick convenience, that sell a lot of beef or a lot of chicken. And those are all the major vendors that we all consume from, because what is the number one product we consume in quick convenience? Restaurants like McDonald's, like Wendy's, like Burger King. It's beef. And actually last year, I think in the last 5 years, we have been consuming more chicken sandwiches than burgers, and that's US market. And there's a shortage on beef already, and there will be a shortage of chicken as well. So no matter whether you're buying burgers or chicken from whatever brand you're buying, there's going to be a shortage on that. And there's going to be even a shortage when you're trying to buy it at the store to be cooked in your home. So this is all the stuff that we need to look at how to do it, because it's impacting even those of us who are claiming that we have no impact. Well, we may not see an impact in whatever we do at work, but you're definitely going to see an impact in what we now are going to have to eat, because none of the stuff that we normally buy at the store is going to be readily available, and we may be paying a much higher price for the same product. Best case scenario, worst case scenario, there will be no inventory when we try to go to the store or even order online. Phillip, can you share your screen so we can do the portal, and then we can get into more discussion if needed?
Yeah, absolutely. Let's see here. All right, so it should be sharing. Do you see the portal?
Yes.
There? Okay, perfect. Excellent. Let's see, which one is this? Okay. So I know some of the people that were on the call last time saw what we were doing on U.S. and the DMV area and global. One of the questions that we came up with about a week and a half ago, when Georgia was reopening. Actually, I guess it's been 2 weeks now. The Georgia reopening, and of course, right? I mean, you have one side over here, one side over there, right? Yeah, of course we should open because it's not a big deal. Versus, are you crazy? There's going to be an insane spike in cases. Again, for me, it's not that I don't care, but feelings aren't that great to go off of, right? Mm-hmm. So let's look at the data. So we put together a dashboard, and this includes all states now as of today, but just clicking on Georgia just to see kind of what's been happening in Georgia. And of course, it's taking a while to load here. All right. Let me refresh the page, find out what's going on.
So your data is being updated daily, is that correct?
It is, and that's actually, hopefully it's not an automation breakdown, but we did automate the process because we do collect data from a number of sources and then have to aggregate it, kind of massage it and clean it and things like that. So we actually did automate that process, which is part of your data collection being part of the services that we do offer. But we decided to kind of prove that out in-house, first of all. I'm afraid to click on Georgia. Okay, here, for whatever reason, it wasn't working a moment ago. I suspect, I'm not 100% certain. Let's see, what's today's date? The 7th?
Today's the 7th, yes.
Okay, so this is the 6th, okay. So what we did is we really wanted to answer the question, you see it kind of over to the right of the drop-down. Does reopening states cause a significant increase in cases? I lived in Tennessee for a while, and they had a saying I don't have a dog in the hunt, right? I mean, there's different ways of saying that, but it's not that I don't care, but whatever the numbers show, and let Georgia, we live kind of far away from Georgia, let that be a use case. If they get a spike, great, nobody else should open up, and if they don't, then maybe we should. So the red portion is the number of cases that they had during the closure from April 4th through the 23rd. The blue to the right is since they reopened. And we knew that we couldn't just look at 1 or 2 days after they opened to make any kind of decisions, or even 4 or 5 days, because of the incubation period of, let's call it, 3 days to 14 days. Mm-hmm. So we said, okay, let's give it at least a week and see if we see anything. I mean, what I'll say is just what the numbers show. Yeah. And this kind of goes back in a sense to, manufacturing employees who don't want to go to work, or Amazon employees who are afraid. Fear is very powerful, right? I mean, obviously the smartest people can motivate people based on fear if you have nothing else. I'm not saying they shouldn't be afraid to go back to work. But I think that they should have some evidence. And this evidence here is based on a state. Mm-hmm. So I couldn't say, hey, if Tyson's had a manufacturing plant or a processing plant here in Dayton, Georgia, for example, that they should or should not be afraid to go back to work, because this is at a state level. Mm-hmm. Right? So certain places definitely need to take more precaution. Mm-hmm. Right? So I don't want anybody to jump to that conclusion or think that I'm jumping to that conclusion. But at the Georgia state level, in the last 2 weeks, what the chart shows is that there's not only no significant increase, but the increase during the red portion was greater. It was 803 new cases per day on average, versus over the last 2 weeks, only 682 new cases per day on average. This is just what the data shows for Georgia. We could track different states. In fact, we're tracking all of them. But that's really the question, is do we have anything, I know politicians, and this is honestly my personal axe to grind. Politicians on both sides of the aisle will look at a case that supports what they want it to support, or just make up information. Because it's not about what's true, it's about what people believe, right? And that's what our goal in putting this tool is, hopefully some unbiased information that just shows, and this is the key, by the way. This is data that's available to us as the public, right? We, USC LA has a new study that says supposedly millions of people have had this coronavirus, and that the death rate is really only about 0.1 to 0.2%. This actually came out of their research, but I don't have access to their numbers, right? So are they using numbers that exist? I don't know. So this actually becomes a little bit the hard part, is this is the data that we have access to. Mm-hmm. And I'm trusting that it's fairly accurate, but we discussed, and you may get into this a little bit more, so I don't want to steal your mojo on this, but the autopsies they've done on people who actually died earlier and in different locations in the US, and they thought that first got hit. Right, so we know there's data that hasn't been taken into account in the data that we have available to build tools like this. Is there any other state that you want to look at in particular?
I wanted to see if what's happening to surrounding states with New York. see if there's any patterns that you've seen since the economy was, since we started hearing all these cases around New York. What is the concentration of confirmed cases on all the other states that are within driving distance?
Sure.
And as you're doing that, I want to share the story because last month we had this particular question that we're posing because you pointed out your wife had gone walking around your neighborhood
Right.
and started noticing parked cars around your neighborhood that have New York plates, right? And this was during the time when there was already a lockdown in New York City.
Right.
Well, I would say a couple of days later, I went out to the store, and I usually will go to. I take one trip, and I go to maybe one or two stores that are in the same location. So in this case, I was going to Costco just to go shopping for regular groceries, and I got there and perfect because parking lot was empty. No one else was there. I get out to the very entrance of the location, and I parked, and there was another car parked in front of me, and lo and behold, where are the plates from? New York. So, and I've seen that if you look at the three jurisdictions that we care about here in the DMV area, Maryland, DC, and Virginia, you look along, where the highest concentration is in Maryland, because right now it's highest in Maryland compared to Virginia or DC. And the highest concentration started with Baltimore County, which is straight down 95. 95 goes all the way to New York City, or through New Jersey and New York City. And then it was Howard County, which is straight down 95 again. And then our county, Montgomery County, which is the Beltway, the northern side of the Beltway in the DMV area, right? And today in my county, I happen to live in, Montgomery County is sending me weekly notices of confirmed cases near me as a service. They have this 311 service that they have, that you can sign up for weekly updates and texting. And in that service, they've been reporting zip code by zip code where the highest number of confirmed cases are in Montgomery County, where I live. And over the period of time, I've noticed that my zip code, along with an adjacent zip code, has the highest concentration of confirmed cases in my county. It's not as near as many as cases as Baltimore County had at one point, and then Howard County, but definitely the ones that are here now in Montgomery County are near me, right? And all this information I'm sharing with all my family and friends that live in the same area. And I'm saying, I'm not really sure that, first of all, I'm not really sure that anybody has access to that information. Montgomery County, I know, is doing it. I don't know if anybody else is doing it in Maryland. And I think that there will be value in sharing that information as to what you can view, based on your portal that you built, that would be useful if you happen to live in specific locations or you happen to be commuting to and from certain areas and you already know ahead of time the likelihood of you encountering somebody who may be infected, is asymptomatic, and that means that you need to be wearing protective equipment anywhere you go.
So that's interesting too that they're doing that on the individual county level, because I know that the data sources that we have at one point early on were reporting on the county level, and I believe that's probably because the cases were so few and far in between. Mm-hmm. Right, so within Virginia, we had a few counties reporting. Up in Massachusetts, there was a couple of counties up in Boston area that were reporting. Mm-hmm. And then once it became, I would say mid-March to late March, they just rolled it all up to the state level.
Yes. And I think that's just what I'm heading to, is that I think Maryland is one of the states that is being more transparent about, what they're tracking and what they're able to tell us, and then making it available for us that at least want to know how safe are we really, right?
Right.
And at least allows us to make decisions, because then that allows me to say, to my entire household, here's the strategy as to how we're going to be surviving this, right? Only one person goes out at a time, and we have a process now as to nothing comes in or out of the house, and no one comes in and out of the house except we announce it, and that one person that goes out once or twice a week, whatever that is, goes through a process by which we're disinfecting everything that we're touching, and that as we go out on the trip, and before we come in the house, we're disinfecting ourselves and anything else that we're carrying from whatever store we're buying before we bring it into the house. And I'm doing this because, my wife is a doctor, is a medical doctor. She knows how to do this. And, she happens to not be working as a doctor here in US, but, she is a medical doctor. And I'm going after the practices that she was taught and she was practicing when she was a medical doctor. So I'm just saying, no, I don't think that most of us have that knowledge, or that we even have access to that knowledge. And ignorance is not necessarily good, because it can lead to, something going on, not necessarily with you, but somebody that you care about, that you love, that is near you, when you're unknowingly maybe an asymptomatic carrier infecting people and you don't know it.
This is an interesting point, because I've heard, kind of different sides of the coin. It's like a 20-sided coin, so more of like a die, I suppose. Mm-hmm. Because I've heard this directly from physicians, the same as your wife's describing. Early on, some friends of mine that are also physicians were on that same page. Very adamant, in fact, I quit watching them, but very adamant on social media about, we need to distance ourselves, you wear the mask, do this, what is wrong with you people? You're killing, people, taking lives. Within the last week or so, and I think, this is something that I had shared previously, but within about the last week or so, their message has changed, saying, look, we did the right thing at the beginning. This is the information we had. It was unknown. And what we did was right. But with the new, with the numbers that we're seeing, with the new information that we have, some physicians literally are saying that this is nothing more than a severe seasonal flu, mm-hmm. with the death rate being more about 0.2%. And it doesn't mean all physicians are saying this, but some are. And so
it's interesting. Let's look at the numbers. Have you found data of what is the average number of deaths during any regular year due to flu in U.S.? Because I think right now, at least right now in the last 100 days, I've already heard that we had more deaths than we had in U.S. That we actually lost people in the Vietnam conflict that lasted a decade and a half or so, right?
Well, what is that number from Vietnam? I'm not familiar with that one per se. I can Google it real quick.
I think that's what we can do. But also we had a question from the audience saying that they want us to look at in your portal the DMV area, even though it's closed. So we can actually do that as well if you can show us the DMV area, because I think that's one of the use cases you had packaged, right? Okay.
Correct. And one thing to note, and I don't know, I'd have to see who that question came from. I did show this off last month. Yes. And the biggest thing to note, I would say, is that last month, Purple had a much bigger slice of the pie. They had about 97% of this slice here. Mm-hmm. And now New York only has about 85. So it means in the last month it's been growing faster in the DMV area than it has been in New York. So that is one thing to note over the last 4 weeks.
Yeah, and what I want to contribute is that out of the 3 jurisdictions, Maryland is the highest. I think it's over 17,000 confirmed cases up to now, and it's been growing. Actually, it's been getting the number of confirmed cases in the last week has been going up in Maryland, which is highest right now. The growth rate is also highest in Maryland. That's what I know, because I've been seeing those numbers on an ongoing basis. Compared to Virginia and DC, we're the fastest rising one. And all I can say is that you can see that pattern that happened over time the last 100 days since March 11, when this was declared a pandemic by the World Health Organization. You can see that it was basically that right along the 95 heading south and coming all the way into the northern part of the Beltway, and then eventually either on the Prince George's side of the Beltway or the Northern Virginia side of the Beltway. That's where the highest concentrations have been in the last 100 days. And I think it's a pattern that people that were in lockdown mode in New York City were trying to get away. They were asymptomatic and were able to drive, and we're driving distance from New York City.
I do know someone, by the way, in New York that just is in the process of closing on a house in Maryland. So I don't know, man.
I'm telling you, this is happening, and I think that if in your portal you can find a way to look at that, going back to, let's say, beginning of March, and see if there's a pattern of confirmed cases along the 95 route, and it can go in both directions, because it could be northbound or even towards there's a diagonal interstate that goes off north of New York City off of 95 that goes towards Boston. And Boston is one of the areas that also has had a high concentration, not quite as high as New York, but think about the traffic the traffic pattern when you're flying in and out of New York. How many flights on a daily basis back in 2019 were there between Boston and New York? I mean, there's a lot of traffic going back and forth, and not just air traffic. It's a driving distance between New York City and Boston.
Yeah, one thing, and I'm actually Googling, I don't know if I'll find it because I don't want to spend too much time at the moment, is the deaths during Vietnam. But I think that what I find the most, not necessarily the most interesting, but we have the data. And I think that the people that are on this call are probably I'm speculating they're probably data-oriented people and more likely to react based on data. So I think that, and I'd like to get your opinion on this. I feel, because this is based on my thoughts and feelings, that people are emotional beasts. Like, they're not logical beasts. They're not show me the numbers and I'll believe it beasts, right? I mean, so with differing information, we talked about, how you guys are doing things in your house, or on the very other end, some other physicians that I've heard, mixed information. And also, I think a big factor is trust. Who's saying, if you're a Republican, you may believe something based on certain things or disbelieve based on certain things, versus, on the other side, the Democrats, same thing. Right. And I think that that's the biggest danger is, only believing things based on emotion. And that holds, I think, other people to a higher level of responsibility to make sure they are disseminating the truth. And I'm not accusing anybody of doing that or not doing that. But I think that having that trust factor is highly important. I don't know. What are your thoughts on that? I mean, numbers aside.
I think it's fear. And I think the only way to overcome fear is really to provide the numbers, right? The facts and figures. Because then, and I think that, for those of us that do analytics, right, I think our responsibility is to not only prove beyond the shadow of the doubt, not just to ourselves, but be able to create a story behind the data, so that we can make it, we can actually say, what does it mean to you? When I say when I say to you, is understanding who you are, what you do, and what is your lifestyle like, right? That, I think, is a challenge, because this is impacting a lot of different sectors that do different things for a living. And, we're, as you saw in the poll, even in this small group, we're all impacted in different ways, right? Some of them are saying no impact. Those of us, other ones are saying, yes, we're well, as far as our health, but economically it's been a huge impact. And then everybody else in between. So I think that really what it is meant is that the challenge is understanding who is most at risk, that we need to then dig, deeper into the data, that whatever data sets are available, dig deeper on that, and then figure out, how to expose it in a meaningful way to the different segments, because they'll be the ones that have very little impact and they think, well, for the most part, we're not impacted. But then, hey, wait a minute, how come I'm going to the store and there's no meat? Or how come I'm going to the store and there's no chicken, right? Even though they're saying no impact, they don't know that supply chains are being impacted, and this is the reason why you can't find things.
Sounds like a tsunami, right? I mean, it hasn't happened yet, but it doesn't mean it's not on the way.
And it may be like, it's a domino effect that may be coming around, and it might, you might be the last one, in the chain, but it's coming, right? And
right.
that's the, and if you know that it's coming, you can maybe do something to prevent it. But, for the most part, if you're just feeling, oh, there's no impact, I'm just going to continue on doing what I do. And then out of mind, out of sight. And then you just, all of a sudden, you get whacked when you didn't expect it. It's like, wait a minute. It's like, oh, okay, maybe I should be more aware of what's going on. And those are the kinds of things that I think is hard unless you are able to at least show the data, and then let the data tell the story. And I think that often that's the role of the analyst, is to figure out how to create a story based on the stakeholders that are looking for that data. And you need to ask them the questions: why do you need this data? Why is it that what is it that it will do for you? The why 5 times until you get to the real need, right? And I think that's a process that most analysts may or may not have the expertise of doing, because I think it really is about the same data can be viewed in different ways, and the only way to make it relevant is to understand who needs it and why they need it.
True. I don't know if there's a way to solicit, Hector. I saw that the person that asked the question about the DMV area is anonymous, so I'd like to number one know if they got the information or the answer that they were looking for.
Yeah, let us know if that's the information on that Phillip presented, which is here on this ring that you see. Basically, the purple area is New York. Is that right?
Yes, correct.
And it's the blue that is Maryland, which is the larger blue.
Right.
Then the gray area is
That's
Virginia.
Right.
And then the aqua is DC.
Correct. I would love to know from the audience, and this is like, we're doing this as a public service, right? We're not making any money off of this. I would love to know some feedback, and I really would like to get some, hey, this is great. Hey, this is horrible. Take it down. We would like to see something that's missing, or maybe something that we did really well. I would really like to get that feedback, and we can continue to grow this and hopefully answer questions for people.
Yes. So if you can type in any information, let us know if you have any other things that you want us to show off of this particular portal. I do want to say that we actually put the live link off of the landing page that we had set up for signing up, so you could actually access this particular portal that Phillip is showing from the page. And we're planning on putting in the post-event landing page that we'll be sending a link to everybody that signed up. Also the link to actually navigate to this page, because this is now live, but you need to get to it. You can't find it by doing a search. You have to have the link, and we'll actually be putting a button in our landing page where you can navigate directly, be redirected to this page, so you can actually just look at the different areas that are available. Can you tell us what areas are available off of the drop-down menu that you have on the upper left?
Sure. Yeah, I was looking through some of the comments here. So what we did basic US or USA, just as a high level. You can drill down. Actually, this one I guess you don't drill down on. It gave kind of a high level as confirmed cases. It gives you the slope and then a 7-day forecast. Mm-hmm. Top 5, and these have changed since last month.
Okay.
Interestingly, I guess California is down there. New Jersey. So you look at population. This was what I was kind of curious about, knowing that New York City being the largest populated city in the U.S., followed by L.A. and then Chicago. Unless anything's changed, those are the numbers I followed. Jersey being, small, but it's right there with New York, and so many people commute. So I'm not surprised to see that at number 2.
Yes.
California, I'm a little surprised not to see higher in the top 5, just due to, the large cities that they have, and LA being so big.
Mm-hmm.
But that's what we have. U.S. We did do the global, so you can filter by country. Gives you a bit. You get to see the global numbers and kind of a heat map. Europe definitely looking the reddest, and it's because they have such a concentration of countries that were affected. And then we just did reopened states. We just have a little bit of a blurb about us if you don't want to know why we did it. But reopened states, in my opinion, right now is kind of the biggest value,
mm-hmm.
and maybe just U.S. overall. And that's why I'm hoping to get some feedback. I appreciate some of the feedback that I see here. It seems positive. And okay, Dave said there's 58,000 deaths, American deaths in Vietnam.
Oh, thanks for sharing that.
Yeah, thanks, Dave. I think the flu in the last 6 months or so is around that number as well. So, COVID's definitely the winner, if you could say such a thing.
Mm-hmm.
And I don't mean that flippantly, by the way. I know some people who, in fact, one of our neighbors, they're, the lady's in-law, father-in-law has actually passed due to it. So I don't mean that flippantly, even though it's easy to kind of sound that way sometimes.
Mm-hmm.
But I would love to know is, what questions are still out there? How could we help answer the questions? And I appreciate the feedback.
Yeah, if you guys have any questions, go ahead and type them in. Use the Q&A. We've been actually answering the questions that have been coming in through Q&A. And let us know if you have any questions. You can either use the chat window or the Q&A portion. And let us know if you have any questions that you want us to answer. And as we're waiting,
we had some good comments. I'm scrolling through them now. Mario had some thoughts on some of the stuff we had said earlier, around CDC guidelines. So I appreciate the comments. It's good to see this interaction.
Yeah, Mario is asking if you have any cleaning supplies near us that we can find in your portal.
Oh, and anything for a friend for a fee. Absolutely.
Now, you mentioned last time, but I think it's worthwhile going through. What's behind this visualizations that you put in this portal? What is the tool that you're using to actually make this happen?
Sure, a little smoke and mirrors, a little bit of bubble gum and duct tape. And actually, and I'll get to that one second. And Mario, I don't know if he was asking this question directly. One thing we did talk about, Hector, was putting together kind of a live map of where cleaning supplies near me are.
Yes,
we thought that could be something kind of interesting. So Mario, I'd like to see if that was kind of what you're thinking about, or if you're kind of making a joke there. But we thought that I would go to Walgreens to pick up a prescription for somebody in my family, and they would have toilet paper randomly. So I'd grab a pack and post it on Instagram just to brag a little bit. Oh, thanks, Mario. It was a joke, but people would message me on Instagram. Hey, where did you get that? Because they wanted to run out to the store right away.
He says it's a joke. He says it was a joke. No, and the other one is somebody else is commenting saying, if we have any material for those that are underemployed or unemployed, a session on how to market yourself and your skills if you're actually actively looking, how to do it so in LinkedIn. And I actually, not at this meetup, but what I can do is I can send you a link. I actually did a webcast just on Tuesday of this week through the Great IT Professional, and it was actually on that topic to how you can actually supercharge your brand if you're looking to if you're currently unemployed and looking for your next career move, and how can you actually deal with the job search process being digital. I will send that information to you via email, and I'll send it to everybody because it's a link. I set up a post event page. Let me see if I can share that real quick because I actually can show off my post event page. I'm gonna stop your sharing, Philip, real quick, and just kind of
sure,
for a purpose to answer this question. What I'll do is I'll send you a link to the page, which is somewhere here. Here we go. This is my
something like this before, so I can. I'd be happy to give you a real short plug. I actually attended one of your events and I thought it was great.
Yeah. So what I did actually, I haven't shown this to you, Philip, because I did this on Tuesday of this week. So what I actually recorded the whole thing. It was a 1 hour webcast, and the way that I put it on my post-event page, and I already shared it with everybody who signed up for the live event for this one. I had about 200 people signed up and about 100 attended. I put the introduction as a video. Then I talked about why personal brand matters, and that's a shorter video. Each one of these is like 10 to 15 minutes long off of that 1 hour. How to make a powerful first impression, which is helpful when you're doing this and you're actively networking, and you can network online is what I talk about. And also how to supercharge your brand, and then the steps as to how you can craft a personal elevator pitch, and how do you deploy that pitch online on your LinkedIn profile. And I have a sample pitch I recorded myself for my pitch, doing a 30-second pitch on video. Everything is available off of this page. I'll send you the link as well, just so you can view this information. It's available for free, and let me know if you need further help. So I can at least share this information, and let me know if you're interested in actually sending this link, because I'll send it to you. If you tell me that you're interested, I'll send it to you guys that are participating in tonight's discussion.
Yeah, that sounds like a really good value add.
Yeah, the Great IT Professional is a great way to get access to on-demand videos. They actually capture the live off of live 1 hour or half hour. They're now fooling around with different formats. And this was my last one that I scheduled with them since like last year, because they usually will schedule things like 6 months ahead of time. And this was the topic that I had proposed, and they put me on. And so I did it on Tuesday of this week. So with that, I'll get the share back to you, Philip, and let you share your portal. Are there any other questions related to the portal? And Philip, I wasn't really sure if you got your answers to any questions. What would be meaningful as far as helping you figure out ways to improve this? You know, what kind of things are you looking for to kind of guide what you can do with this portal?
Yeah, we got some good, some positive feedback. I hadn't had any new suggestions yet, except for Mario's joke. But the one thing I wanted to add to that last question is even as a business, a lot of business that I've gotten, I can't say all, but a lot of it's been off personal relationships, and that's, believe it or not, actually how I started my business. Had a full-time job. I will say in a 100% non-braggy way is that after my first job out of college, I've never applied for another job. And what I meant is that people that enjoyed working with me came to me with opportunities. And that's kind of how I hopped around, is people just, hey, can you manage this project over here? Hey, can you do this? And assuming this person asked a question that has built a similar reputation, I would tap into their network of people who've really enjoyed working with them. Mm-hmm. And maybe that's in your slides. I don't know.
No, I talked about, on that most of us, especially when we're so focused on a career plan, we mostly focus on improving and adding more to what we know, right? Going from a bachelor's to a master's to certificates, credentials. That's hard skills, and it's what we know. Very few of us either have that think that, or even consider that we need to also continue to improve on who we know, because at any one time,
great point, yeah,
we may not have enough of the right stakeholders in who we know in our network, and we don't network at all because we either are introverts and we just like to be in front of a computer coding or looking at visualizations, and we don't necessarily feel comfortable going out there, right? And
very fair point, yeah.
In the case of I think what made you successful is that maybe you did it consciously, maybe you did it subconsciously because of your personality, but not only did you prove that you could deliver because of what you know, and you continue to improve that over time, but it's also allowed you to start increasing the number of people of who you know, and you're doing both, not one or the other, you're doing both. what I talk about in this particular example is that what I find, because I'm myself, I'm technical, right? I have a bachelor's and a master's degrees in electrical engineering, and I did development for a long time. But now I've been in management, and management means that I realized very quickly that there's a certain, you reach a certain limit as to how much more benefits you get by adding more to what you know when you're already an expert across domains, right? But now the focus is on growing your network, who you know, and that is networking and presenting your brand against the right stakeholders in the right way that gets you top of mind when it's not necessarily going to be immediate job offers, but it's going to lead to, at some point, those people that you know and you continue to expand over time, at some point, those people will become hiring managers. And then they will, once you have shown them what you know and what you can do for them, they'll remember you. And without even you having to apply, they come to you first. It's almost like you have the first right of refusal to a job offer. And you kind of bypass the typical job search process.
Very true. I've actually experienced that myself, both personally and as a business.
Yep. So Mary is also typing in another comment saying, an advice to promote your website, to add links to the website to increase traffic, like CDC and others. So like like backlinks or referral links.
Okay, perfect. Yeah, that's a great idea, actually. And I appreciate that, because we do get our data from a number of places like Johns Hopkins CDC and some of the foreign CDCs. So it makes sense.
Yep. Yep. So what I wanted to do is I think we're way over our time, but I just wanted to ask, are there any other questions, any other comments before we kind of wrap up? I know that I just want to make sure that at least we don't leave anything unanswered and before we wrap up.
How are these comments are good, and I know there's quite a few, so I was scrolling through these. I know Maury sent some links. How do we access the comments afterwards?
I will send those over to you, because I actually get not just the video file and the audio file, I get the recorded chat timeline. Okay. I can send that to you for any information that you want to mine from that.
Okay, great.
And I think that's typically what I do.
Sounds good. Thank you.
Okay. So if there's no more comments or questions, and I don't see any more, what I'd like to do is I want to thank all of you for being here tonight. We will be announcing a topic for next month. We do have that meeting scheduled, and it will be virtual, regardless of whether you guys, some of you may be already at least doing some actual commuting in your time, but we're going to be virtual again next month. And then we'll be announcing also in between whether August is going to remain virtual or not. Right now, we're kind of playing it by ear, because it depends on whether a sponsor comes in and it feels comfortable doing a virtual. And I think that even as we go back to a new normal, we may actually do a hybrid where we're actually going to be, similar to what we did in March. For those of you that attended in March, a few of us met physically together, but we had the sponsor, the actual presentation virtually delivered, and we might do that once we get to the point where we actually are able to get back into a physical location. For right now, I believe Make Offices continues to be officially closed in the Tysons area, and I'm actually getting weekly updates from them. I will let you know, and then I will announce what is the earliest opportunity for us to do a physical meeting. But for the meantime, we're going to stay virtual doing this. And what I would like to do is actually get your comments as to how we can improve the format, because part of this will be that we're trying to be at least good citizens and not be hogging bandwidth. That's why we're actually doing this format where it's maybe two, no more than three people actually that we're able to talk and interact. But we want to make sure that you feel comfortable with the chat capability, your ability to get to Q&A, and at least be heard. Let us know how you like it, because I'm willing to try a different format, because the beauty of this platform is we can actually make it more interactive if needed. If that's what you guys are really looking for, let me know. We can always, the next month we can actually try a slightly different format, so that to allow that level of interaction, that I want to make sure that everybody feels good about, the level of interaction that we're having as we're having these conversations. So with that, I would like to thank you, Phillip, for being here and being gracious enough to demo this. I mean, you've been working hard, and I want to thank you for all this. Hoping that, in the next few weeks, we can actually come up with some models. I do want to mention that on the 15th of May, Apple and Google have announced that they will actually turn on Bluetooth capabilities and beacon technologies they'll make available. And as I mentioned Google, my Google thing turned on my phone. Tell me they're not listening to us.
That's a good point. This will be the newest feature we're gonna add for next month, is we're gonna track the number of burner phones sold.
And I'm guessing there'll be a lot more of the, those flip phones that are not smartphones,
right?
Compared to smartphones.
Exactly, but, man. Hey, something I put in the comments. I don't know if anybody will see it, Hector. I wanted to thank you, because I know you put in a lot of effort every month to make every month awesome. So thank you for all that effort.
Well, thank you. It's my pleasure, and I'm hoping that all of everyone who is a regular attending member will continue to engage with us, and feel free to reach out either via email or via LinkedIn. Connect with me on LinkedIn. We'd be more than happy to share any additional information that comes in between, and let me know if you're interested in either being a panelist in whatever it is that you're doing. We can just have a chat, and we can set you up for a future meetup. Just reach out, and we'd be more than happy to accommodate you as needed. And so for that, thank you once again, Phillip, and thank you everyone for attending. And we hope to see you again next month, same time. And looking forward to your feedback on tonight's discussion. Thank you so much, and have a great night. And you stay safe and be well. Okay.
All right. Bye, all.
All right. Take care. Bye-bye.